Good morning, everyone. It's time for the Henry County Health Center FYI. And this morning we are talking about Park Place Elder Living. It is National Nursing Home Week next week. So we thought, who better to talk to than Park Place? So ladies, please introduce yourselves and tell us a little bit about what your role is at Park Place Elder Living.
Good morning, Katie. My name is Ann Abels, and I am the current administrator at Park Place. I've been in long-term care since 2005. I've been an administrator since 2007. So, I'm so thrilled to be here.
Good morning, Katie. I'm Kara Blow. I'm the Director of Nursing at Park Place. I have been in long-term care basically my whole life. My dad was in long-term care, so it's kind of the family business. I worked at Park Place early in my career and came back in December, so this has been really fun.
Well, ladies, I know that people who work in elder living centers are super busy, so let's cut to the chase here. Thank you for joining me this morning. We mentioned National Nursing Home Week, so talk about what Park Place Elder Living offers to their residents and their families, and what sets you guys apart from maybe other long-term care facilities in the area.
I feel like at Park Place we really try to offer, a family-like environment, and we really put the interests of our elders and the care of our elders at the top of the list, and I feel like that's really important. We are from a small community, and I feel like we try to continue that sense of community throughout our whole facility.
And another philosophy I think that we bring here to Park Place is I've always been big on, when our elders come here to live with us, it's usually the last place that they live before they go home, and I really want us to make sure that that's what they do here, that they live until they move on. So we want to make it person-centered here. We want to make sure that all the things that they were doing at home, that continue to do that here, and make it the best we can possibly make it.
Well, I know during COVID, you guys were affected greatly. A lot of changes for long-term care facilities to keep people safe, and so where are we at now with COVID, and what types of activities are your elders doing right now?
Well, I feel like, we're kind of starting to come out on the other side of COVID a little bit. Now, there are still some things that we have to do. We still have to have our masks in place, and we still have to do our screenings and things like that, and we still have to try and maintain our distance. But we're starting back to imbuing the lives of our elders with some more activities, more spontaneous things, being able to, have visits with their families again. I mean, even during COVID, there was a time where they could only see people through a window. We're back now to where they can come and go as kind of as they please, as long as, we're all doing the things to keep everybody safe. So I feel like we're not back to 100% normal, but we're getting closer all the time, and just following what, our regulations say, but trying to also continue to get the elders the social needs that they have met.
Yeah. And we are bringing outside activities in. So people who used to come in from the community play the piano. We've got church coming in, and so we've had other activities where people from the community are back in, and so that has been so nice to see.
Yeah, I feel like the situation is still so fluid and ever-changing, and I can only imagine the amount of juggling that you guys have had to do to try to balance that safety with that what's so important, social connection. So, I mean, how do you involve elders' families in their daily living there at Park Place?
Well, we've started bringing in we've been handing out our activity calendars and making sure that our families know that activities are back in place. Like, for instance, this afternoon we're doing bingo, so some of our family members will come in and play bingo with their loved one. Again, we do the social distancing as much as we possibly can. We're still having our family members wear their masks and so forth, but as whenever we can get our families in to participate, that's what we want to see happen, because we know how important it is for our elders to, again, go back to activities, but then also to see their loved ones.
And I'm sure, for you guys too, it's a balancing act of involving the families, keeping the families up to date with what's happening, and also, giving the best care absolutely possible. So let's talk about that care a little bit. And maybe, Kara, with being the director of nursing, this is more your realm, but what are the benefits of Park Place being a part of the Henry County Health Center? Do you want to touch on that?
Absolutely. I think one of the big things is accessibility for our elders. We don't have to necessarily have like a transportation service to take people to their doctor, because we're just right across the way. We can just push them over in their wheelchairs or however they get over there to see their physician. Same goes for like the physicians to come here if the need arises. We're just really close to and able to access a lot of services where it's more difficult in a facility that isn't on the same campus as their hospital.
I guess let's end with talking about employees, because as we all know, they are the lifeblood of any business, and especially when you're caring for other people. So talk about the Park Place Associates and talk about why they love working there.
I've been in long-term care now for a long time. I was trying to put a number on that, but I couldn't get to figure out right now. I have to say that I have a very special group of staff here at this facility. I think they really think about their elders first. They really want to make decisions in their best interest. They really want to work together as a team to make all those things happen. And I feel like that sets them apart. It's also benefits just with being part of Henry County Health Center that are set us apart a little bit from maybe other facilities too. There's excellent benefits, and there's lots of those kind of things also. But I really think it comes down to just they really are a great group, and they really love what they do. I think the pandemic especially kind of, I guess, fleshed out those people that didn't really love to do what they're doing. And so the group that we have now is really, really special, and really are here for, to take care of these people. And that's what we really want here.
Are you guys hiring? I mean, is that something that you need more people to apply?
Absolutely. We are always looking for more people that want to take care of our elders.
So how can they go about maybe applying?
The Henry County Health Center website, there is an application online, or a place where they can go and look and apply for a specific position.
We've talked about employees, and it is a 24/7 gig, but it's 24/7 for the people who live there too. And maybe there's people listening who have a parent that they need long-term care for, or maybe they themselves are looking for that next phase in their life. What can people do to learn more about Park Place?
Well, they can always come in and have a tour of our center. We I've quite enjoyed that part of it since I've been here, is giving tours. And then we have an application process that we have the family fill out, which tells us a lot about the elder and what they like to do, what their likes are for food, so that if they do choose to come in, then we know how to best take care of them. So we also have a social worker. Her name's Brady, and she is great to work with. So if they would decide to come, she goes through all the steps of, what needs to happen before they come through the door and move in. But yeah, it's a very, very easy process. So we would be thrilled to have anyone come in, even if people aren't ready for that part, that they could come in and still tour our center.
And if they're looking for more information, can they give you a call?
Oh, absolutely. Absolutely. My direct line here at Park Place is 319-385-5350.
So the direct number to Park Place, and there's a choice where you can pick to talk to the social worker or the director of nursing or the administrator. So that's also an easy way to get a hold of us. That number is 319-385-6192. My direct line is 319-385-6192. 6522.
Fantastic, ladies. Well, it is National Nursing Home Week next week, so I want to say happy Nursing Home Week and thank you for all that you guys do at Park Place Elder Living. We've been talking with Ann Abel, the administrator, and Kara Blow, the director of nursing. Thanks so much for coming on this morning.
You bet.
Thank
Thanks so
you.
much.